ladies complain of bleeding and they even term it menstruation. In some situations, some even bleed monthly for 3 months, 4 months, 5 months. Hello everyone, thank you so much for tuning in on this episode of our health discussion. On today's discussion, we will be looking at implantation bleeding. We'll be discussing what it is and explaining it in details. We'll also be looking at a very big question which some ladies have been asking, that is, can a woman menstruate after she has been pregnant? If you're a lady who maybe menstruate or bleeds after pregnancy, please follow us through and you see how we explain this. If you're a lady who have been hearing that a woman can actually menstruate after pregnancy, also follow us through as we explain this together. If you're tuning in for the very first time, please don't forget to hit that red subscribe button and click notification. Also share this video out to friends and family members. Thank you so much. For fertilization to occur, you need an egg and a sperm to meet in the fallopian tube. And once a sperm fertilizes an egg, then fertilization occurs, and after that we have what is called implantation. Actually, implantation is the burrowing of this fertilized egg into the walls of the womb, that is, into the endometrium. When the fertilized egg comes down and burrows itself into the endometrium, that is called implantation. This implantation occurs generally between 10 to 14 days after your ovulation. It therefore means it will depend on your ovulation, and you will see that around 14 days after your ovulation is already the end of your cycle, and that is why some ladies will have this menstruation they call at the beginning of maybe a new cycle, and to their mind it is actually menstruation. But is it really menstruation? The answer is no. Why? Because that is actually what is called implantation bleeding. So if you have this bleeding around the end of your cycle, then it is likely implantation bleeding, because implantation bleeding is most likely 2 days or 1 day flow that is light, and it occurs just because of this burrowing of an egg, of a fertilized egg, in the endometrium. During this burrowing, not every lady will have this bleeding, but those ladies that have this bleeding, it is actually implantation bleeding. You will see here that for ladies who are 28-day cycle, for example, your implantation bleeding might occur around maybe day 27, day 28, day 29. It therefore means around the end of your cycle. If you're 30-day cycle, it may also occur around day 28, day 29, day 30. That is just around the time you are expecting your next flow. And you will be tempted to think that this is actually menstruation, whereas it is not. Now, if you have been maybe having this and you feel that it is menstruation, please, you are more likely having what is called implantation bleeding. For those who may be having this bleeding for 2 months, 3 months, 5 months, you will not just see it at home. It is always proper for you to visit your healthcare provider. It should be your doctor to tell you that this is normal or it is not normal. But remember that most likely implantation bleeding will occur just around the beginning of the next cycle for the very first month, because you will not have continuous implantation bleeding, since implantation occurs once. So once you have it, you've had it already. You will not have another implantation. So if you continuously have bleeding, then this is something you should talk with your doctor. But remember, this is no longer anything like menstruation. So we are casting out menstruation once you are pregnant. Now, once you are pregnant and you still have bleeding, like we said, visit your doctor. Doctor should be the one to tell you that this is something that you should not worry about, or this is something you should worry about, and he or she gives you the way forward. For ladies who may be having trouble in conceiving, this may be tricky, and that is why if you bleed as a lady after the end of your cycle, if the bleeding is not like the regular bleeding that you used to have, then please don't just go ahead and do your normal things. Always try to still follow up, because you might be pregnant, and because you were going ahead doing your normal things, something happens to that pregnancy, whereas it's a pregnancy that you have been looking for maybe for 3 years, 5 years, 10 years. So it is proper that whenever you have bleeding at the end of your cycle, if you doubt the texture of that bleeding, then please visit your doctor for a follow-up that will help you to know whether it is something that is maybe pregnancy without you knowing, or is just your normal flow that is scanty, or it could be something else. So I hope this clears out. If you have any question, please, you can visit us on Instagram, check your health and maintain, or you send us a WhatsApp message through 00237 666 006 107, 00237 666 006 107. We will see how we can talk with you, and this is health exclusively, not something else. Thank you so much. If you enjoy our article, please don't forget to subscribe, and you share this to a friend, share to family members. May God bless you. See you in the next video. Thank you so much for watching this article. We really do appreciate. We are Check Your Health and Maintain Your Wealth. Here we discuss reproductive health and social health on this channel. If you are someone who loves any article on reproductive health and social health, then this channel is for you. If you have friends, family members who will need information on reproductive health and social health, then this channel is for them as well. Please don't forget to subscribe. If not subscribed, don't forget to recommend our channel, Check Your Health and Maintain Your Wealth, to friends, family members, and well-wishers. Thank you very much. May God bless you. Do have a wonderful time. Thank you.